Okay, now let's create a patient care plan. So over in the left-hand column, let's click on patient care plan. And in the header, we're going to type initial care plan. Now you'll notice that there are three columns in this screen. The left-hand column contains permanent descriptors that are in here that try to describe what we're looking for. The middle column has drop-down boxes that you can check one or many of them. And the right-hand column is a free-form area where you can further describe what needs to be done. So the very first line, the informed consent obtained, we're using that for things that the intern needs to follow up with. So if there's any items that need to be followed up with, the doctor is always going to look at that very first box to see what needs to be done. So in this particular case, report of findings needs to be done first visit. And the intern also needs to do an informed consent. So anything that needs to be completed by the intern will be done in this very first box. The faculty doctor will right away be able to see what needs to be completed. For the problems, you're going to choose the patient's actual problem. The planned start date is the examination date. Frequency of care, however many times you want to see the patient, and duration for how long. The estimated plan end date will be your reassessment dates. In this case, it's going to be 30 days. It usually will be. However, that may change depending upon the patient. You want to also type in the free form when the reassessment is due. And this is so that the doctor can easily spot when the reassessments are due by seeing it in this column. The next field is your phase of care. And I do realize that many of you may not understand a lot of these concepts yet, but you will get them in your CLET classes as well as your 7th quarter clinic class. Services performed in this particular case, we're going to do spinal adjustments. Re-examination date is when you want to do your rephysical. So in this case, it's 3 months out. And then follow the rest of these. So if there's any home care recommendations that you've made for exercise or whatever. Short-term goals, we have an entire ADL section where we do have our goals listed. So just check that box. Any outcome measures that you have performed, you need to put them here. So any questionnaires you gave your patient, check them off here. And you need to put your scores, the current scores for those, right over here. So for this patient, we gave the patient the QVAS for their neck and also for their shoulder. Chiropractic treatment alerts if there's any condition that may interfere with the care of the patient, whether it's adjusting them or even if it has to do with therapy. You need to make sure you select one of those and describe it in the free-form area. If there's an area that should not be adjusted or should be adjusted with caution, you need to check this box here under risk contraindications to care and then type it in here. So a typical example would be if there's a compression fracture, we don't want to be adjusting that region. Techniques to be utilized, you want to select your technique. If you're doing full spine and you have x-rays, you want to make sure you put your x-ray listings here. Any conditions that you're monitoring, such as blood pressure or anything, you want to check this box and then let us know what it is in the free-form area. Any health risks, Select the appropriate box and type in anything in the free-form area that you need to. Any nutritional advice you want to check here. And any restrictions in any of these categories here. If you prescribed orthotics for the patient, any special tests that need to be ordered, including x-rays, would go here. Any referrals, and we're going to refer this patient to functional rehab for a shoulder evaluation, and any treatment modifications go here. And you can view your patient care plan by clicking View in the lower right-hand corner, and this is how it's going to appear in the notes.